name is Susan, and I'm going to be assessing your cranial nerves today as well as your reflexes.
Okay.
Okay, the first cranial nerve that I'm going to assess is called olfactory. It's your first cranial nerve. I'd like you to first occlude one of your nostrils for me and just sniff in and out. And it's patent, correct? No problems. Occlude the other side for me now. Sniff in and out. Patent. Good. Now I'd like you to close your eyes and occlude one side of your nostril for me. One nostril for me. Thank you. And if you could smell this, and if you could tell me what it is.
Vanilla.
Now if you could occlude the other side, and if you could sniff, and could you still smell the same smell?
Yes.
Perfect. Now I'm going to assess your optic nerve. By doing this, I would use an ophthalmoscope and I would examine your ocular fundus, noting the color, size, and shape of the optic disc. However, I do not have an ophthalmoscope today, so I'm going to assess cranial nerves 3, 4, and 6 now, which are your ocular motor, trochlear, and abducens. I'm going to be checking your pupils for size, regularity, equality, reaction to light, and accommodation. Just look straight at me, please. Good. I'm going to now be assessing your movements of your eyes. If you could look up for me. Good. Down, to your left, and to your right. Good. I'm going to now be assessing your trigeminal nerve, which are your muscles of mastication. If you could clench your teeth for me. Good. I'm going to be, if you could unclench and now clench again. Good. I'm going to push down on your chin. Good. Now, if you could close your eyes, I'm going to touch this lightly to your face. Can you feel that?
Yes. Yes. Yes.
And again, if you could say yes when you feel it.
Yes. Yes. Yes.
Perfect. Now I'm going to be assessing your facial nerve. That was cranial nerve number 5. Now this is cranial nerve number 7. It's called your facial nerve. If you could smile for me. Frown. Close your eyes tightly. Okay, now keep your eyes closed for me, and I'm going to touch lightly, trying to open them. Try to keep them closed. Good. Lift your eyebrows for me. Show me your teeth. And now puff your cheeks. You can open your eyes too. I'm going to lightly touch your cheeks, pushing the air out. Good. I'm going to now ask you about your hearing. Have you had any problems with your hearing?
No.
Okay, I'm going to do a whispered voice test. I'm going to have you press your one ear in and out. And I'm going to hold this piece of paper in front of my face. I'm going to whisper 3 numbers or letters, and I'm going to have you repeat them. You can intermittently press this. I'm going to say 3 numbers or letters now.
A, 2, B.
Good. And the other side?
3, 6, F.
Good. That was testing your acoustic cranial nerve. Now 9 and 10, I would be depressing your tongue with a tongue blade, noting the pharyngeal movement of you saying ah. So if you could just stick out your tongue for me, say ah.
Ah.
Good. For today's purposes, I do not have a tongue blade. I would then examine the gag reflex. Now I'm going to examine cranial nerve 11, which is the sternocleidomastoid and trapezius muscle for equal size. If you could rotate your head towards my hand. Good. And now to the other side. Good. And then if you could shrug your shoulders for me. Good. Now I'm going to have you stick out your tongue. Good. And repeat these words. Light, tight, dynamite.
Light, tight, dynamite.
Good. That is the end of the assessment of the cranial nerves. Now I'm going to assess your reflexes. I'm going to start with your biceps reflex. I'll hold your support your arm here, bent, relaxed, okay? I'm going to now check for reflexes, good. I'm going to now assess your triceps. If you could just, I'm going to support your arm here, holding it up. Just let it go dead weight, okay? Good. I'm going to now assess your brachial radialis. I'm going to have your thumbs come together. Good. I'm going to hold your thumbs, and I'm just going to test your reflex. Good. Good. Now I'm going to assess your quadriceps. If you could cross your leg for me. Good. I'm going to feel your muscle at the same time. Good. Now I'm going to assess your Achilles reflex and your plantar reflex. If I could have you put your legs up on this for me. Thank you. Perfect. I'm going to dorsiflex the foot. Good. And now I'm going to have you plant your foot like this. I'm going to take the reflex hammer, stroking the lateral aspect of the foot, checking for plantar reflex. Good. That concludes our assessment for the day. Thank you very much.
You're welcome.